Welcome to the Alex Salmond Show from Scotland, where we turn once again to the dominating issue of the day. Now, the 4 countries across the United Kingdom are performing well in the vaccine rollout, and it does seem like the end of this nightmare is tantalisingly in sight. COVID-19 has left the UK with more than 125,000 dead, one of the highest in the world, and more per million of population than even Brazil or the USA. The UK has also suffered one of the biggest economic impacts in terms of GDP, even if the continuing furlough schemes are disguising the impact on unemployment, at least thus far. However, from a health perspective, the virus is far from done with the population in terms of suffering. Today, we examine the condition of long COVID with 2 experts on the debilitating impact of this dreadful disease. Danny Altmann is an immunologist and Professor of Immunology at Imperial College London. Dr. Nathalie MacDermott treated Ebola patients in Africa, but is now a victim of the debilitation of long COVID. Today we ask, even once the virus is held at bay, what are the long-term impacts of the pandemic? But first, to your tweets, emails and messages in response to our show last week featuring Professor Danny Blanchflower of Dartmouth College. Professor David Blanchflower applauded the new Biden initiative to help the poor in the US, but also warned against any attempt by the UK to return to austerity. Ray says, enjoyed the interview with Danny Blanchflower on Biden's recovery package, however was surprised the Democrats' failure to bring in their promised $15 minimum wage wasn't mentioned. Well, Danny himself replied directly to that tweet from Ray saying, well, I wasn't asked about it, and fair play, he wasn't. Hopefully we get him back on the show again soon to discuss that amongst many other issues of the economy in the US. And in terms of the UK economic response to the pandemic, Professor Blanchflower also turned his sights on the Chancellor and his plans for the future. And Habib said, a billionaire Chancellor has no understanding or empathy with people on the kind of income that nurses have. Wendy Graham-Gordon said, well, that's nice to know in terms of plans for ending austerity. That's nice to know, as I'm struggling to support my disabled son on my own disability, since his was stopped along with my own, which was returned at a lower rate. And finally, Ira has a brighter outlook from a Scottish perspective and says, we can create proper economic recovery in Scotland when we are no longer shackled to Westminster, control our resources, develop our potential with a clean sheet. And let's face it, if we can develop a huge amount of renewable energy resources from the oceans around Scotland, it starts with what's made in Scotland stays in Scotland. Just a year ago, the long nightmare was gathering pace across the 4 countries of the UK. But the vaccine has brought real hope. But for so many, the nightmare continues. Alex is in conversation with Professor Danny Altmann on this subject.
Professor Altmann, what exactly is long COVID?
So we've all been familiar with COVID, the idea that you get acutely unwell, you're PCR positive, you become breathless, and you expect to get better in 7 days or 10 days. And from the beginning of this, it was seen that there was a very large subset of people who simply took several weeks or months or now a year to recover, who still had fatigue and breathlessness and brain fog and problems with their movement and their guts and many others that just lasted and lasted.
Now, a year ago, when we were experiencing the impact of the pandemic for the first time, this was very much thought to be a chest infection that affected people's breathing, but it seems to be a great deal more than that, particularly for long COVID sufferers.
I think one of the real confounders for long COVID is how multi-system it is. It moves around your body, and that teaches us something about all the places the virus has been to do damage and all the different organs it can affect.
So is this an example of a virus which almost detects the weak parts in your system and attacks them specifically?
Well, it almost is like that, isn't it? So I think most people, it's been a year of steep learning curve for science, and everybody has learned loads. And one thing they've learned is the receptor for this virus is called ACE2. And ACE2 is in many parts of your body, not just your lungs. So there's many parts affected.
And is it true that the term long COVID came from sufferers explaining their condition to each other online on the internet?
Yes, I think that's really important. Very important to understand that the the understanding of long COVID, the agenda, has absolutely been led by the sufferers themselves, recognizing it's a thing, giving it a name, just fighting for some attention, which they so urgently need. And it's a kind of phenomenon of the social media age that they've really made the running on this in a very intelligent way.
And how does that leave yourself as a scientist, an academic, an immunologist, in terms of understanding a condition which is very much dependent on human experience, but is very multifaceted?
Well, it's a new experience for me, and in a way, a very rewarding experience, because this is a chapter of the textbooks that hasn't been written yet. We don't know anything about it. So, how am I going to learn about it or know what to research? Only by asking the people who've got it. And luckily, they're very networked, very articulate, very well informed, and they're telling us what to research. And that's a great situation.
There's sometimes the comparison is being made with ME. Is that a useful comparison, or can that be misleading?
Well, I think it is and it isn't. It would be useful if we understood more about ME, but all these years later, we don't understand it very well. So the use I get out of that is that they can feed off each other and inform each other. And whatever we learn, I think it'll be useful across the board.
Now, by definition, we can only have a year's experience of long COVID sufferers. But in terms of the cases that you've seen, should people be hopeful that even those suffering from long COVID will gradually get better? Or is the situation for some people even more serious than that?
Really, really important question, yeah? Because as you say, we don't know where we're headed. This has all been uncharted territory. And I've never known what to tell people. Is this a 6-month story, a 2-year story, a lifelong story? And that has implications for them, for their lives, for healthcare provision, for policymakers. Really hard to know. I'd like to imagine it won't be too long term from things I've seen in other viral infections, and from the point that I've seen some people already recovering. But who knows?
And in terms of the study of the condition, are we any closer to understanding how the virus is interacting with the body as a result of people being under observation and treatment?
Well, part of the phenomenon of this, this crazy year we've been through in the last year is that we've become very impatient, and all of medical research has been on fast forward, and everything has come at us so fast that if there's a brand new disease and, some months into it, we still can't explain it, we feel impatient. So the answer to your question is that we're kind of at the beginning of that story and have our tests to do and our hypothesis, but it's early days.
Now, understandably, a great deal of the focus of those suffering from COVID has been on the acute condition, the intensive care, and some drugs which have improved the prospects of people going into intensive care. Has it been difficult to get the same focus on the long-term effects of long COVID as there has been on the acute suffering of those in the intensive care wards?
I think it's very important. It's been very hard to get attention for long COVID because, you sum it up very well. There's a big difference between the acute emergency of somebody having to go to intensive care because they can't breathe and might die, and somebody who says, well, I used to cycle to work and now I can hardly walk, or now I can hardly get out of bed. So it's a much more nuanced diagnosis, much harder to count, much harder to get attention, much harder to get funding for research.
Well, science, of course, is giving us great hopes with the vaccination programme, and we're certainly not out of the woods yet, but nonetheless, hope is rising. It's in the ascendancy. Is there the same optimism for the prospects of people who are suffering from long COVID?
Up to a point, I'd like to think so. I think that the vaccine discussion was a different one because vaccinology was so advanced, ready for battle. We knew what we had to do. We knew which vaccines were needed. And we had stupendous vaccines that had been in preparation for 10 or 15 years that were ready to go as soon as we knew that we had to put this spike antigen into them and make them, and they all have been absolutely wonderful. For long COVID, we don't quite yet know all the details we're dealing with, but I think the second we can get in there and do all the analysis, I think things, yes, might move quite fast.
And are policymakers beginning to, in the same way as they have the daily press conferences to say how many infections there are, what the death rate and casualty rate in the hospitals are, the number of vaccinations that are taking place, are policymakers getting to grips with the long condition and all that means for workplace policy, for general practice, being able to identify the condition? Are we getting close to saying we're going to have to really look at this if we're going to help the people who are suffering?
I think it depends what you mean by the words getting to grips. So I think the UK has been better than some in terms of realising it's a thing and saying the right words and acknowledging that something has to give. On the other hand, it's not enough simply to take a clinic and nail up the signpost that says long COVID clinic this way, because you need to know which doctors have to sit in that clinic, what their specialty should be, what tests they're going to give, what treatments they're going to give, for a disease that could affect the lungs, the kidneys, the heart, the brain. This is many doctors of many specialties who need to team up to resolve this. So the declaration of intent is step one, but actually knowing how to do it is, a long way to go.
Now, in your work, you've come across many patients, many sufferers of long COVID. In your experience, what is it can be said to people who are suffering from this new condition, which is very difficult to explain because it's attacking the systems in multiple ways? Is there an aspect of hope and an encouragement that can be given to those who are under the cosh of long COVID?
Yeah, I think they are under the cosh, and they're very desperate because many of these are young people, formerly very active, whose lives are transformed, whose jobs are threatened. Some of them have lost their jobs. Their lives have been turned inside out and back to front by this thing. And I think all that folks like me can try and do is use our knowledge of immunology and other viral infections to try and put forward the best possible hypothesis of what this is all about and get working on it and try and offer some solutions. And this is, like I said, this is a very informed group who I think are quite receptive to that kind of discussion.
And is there a lesson for wider society from the last year that we're going to, as a society, have to mend our ways because we might be seeing the shape of things to come if we don't?
So many. You could do a whole TV series on this, both about the way we live on the planet and the fact that we have more and more zoonoses, movement of viruses from the animal kingdom into ours. If you think about HIV and Ebola and MERS and SARS and now this one, because we encroach more and more on other environments. And then I wouldn't be doing my profession a full justice unless I said that we need to be prepared in terms of our capacity and medical research for these emergencies. The quote from me was, if you think medical research is expensive, try looking at the last year and the cost of not doing enough of it.
Professor Altmann, thank you so much for joining me on the Alex Salmond Show.
Pleasure.
Join us after the break, where Alex is in discussion with someone debilitated by this very condition of long COVID. We'll see you then. Welcome back. Now, the term long COVID was born out of many online discussions at the start of this pandemic. But for many, it's not a virtual reality, but a real-life disease that people are suffering from. Alex is now in conversation with Dr. Nathalie MacDermott, who herself is trying to recover from long COVID.
Dr. MacDermott, thank you very much for joining us on the Alex Salmond Show.
Thank you for having me.
Now, Dr. MacDermott, when did you first realise that the infection you had was having a long-lasting impact? When did that realisation first come?
So I think I initially had COVID in March of 2020, at the end of March, but I made a full recovery from that. And then in May time, I think I was infected again, and I had an almost identical illness to what I had in the March time. But I also developed nerve pain in my feet, which I thought was a bit unusual, but I assumed it would settle down. And then after all my other symptoms settled down, after about 2 weeks, the nerve pain in my feet continued, and I noticed that my legs weren't as strong as they had been, and that just things didn't seem to be quite right. So it probably started fairly soon after my acute symptoms finished, and this didn't settle down.
Now, long COVID, indeed the term long COVID, seems to have emerged from groups of people suffering from the condition, exchanging their experience across the internet. But of course you're a physician, so you would also have the medical background. But was it part of the groups who were experiencing the condition that led you to believe that what was happening to you wasn't just to you, but to a large number of people?
Yes, so I suppose in the summertime of 2020, I actually hadn't really connected with any of the groups yet. So I just realised that things weren't getting better, and then things took a significant downturn in the September time. But I really only became connected with the groups probably about August 2020. And at that time, then I realised that I wasn't alone in having ongoing problems. But I think that the scale of the situation was still coming to our knowledge. So we realised there were quite a few doctors, but we also then gradually realised there were an awful lot of other people who were experiencing ongoing symptoms.
And how did it impact on your own work in the health service? Were you able to continue to work, or was the condition just so debilitating that wasn't possible?
So for the first about 3 months after it happened, I was off work, largely because I couldn't walk far enough to actually get to work or walk around the wards. So I didn't really feel I would be safe carrying an on-call bleep or anything like that. And then from the September time, I returned to my academic research job for 6 months, which I was able to do from home. So I've been doing a slightly reduced number of hours, but working from home since then. And I returned to clinical work in March, but I'm doing that virtually at the moment. So doing clinics and things using Zoom or Teams.
Dr. MacDermott, you've been one of the people who've been able to speak out about the condition. Indeed, you've addressed the all-party parliamentary group at Westminster. Do you feel that the message is getting across to policymakers that long COVID is a real condition, that many, many thousands of people are suffering from, and something has to be done to recognise the impact that it's having on a large section of the population?
Yes, certainly since the end of last year and into the beginning of this year, there's been a lot more attention on the situation. And I think people are taking it seriously now. Certainly NHS England advertised some money for clinics to support people with ongoing problems following COVID. The NICE guidance was published at the end of December time with the initial sort of guidance on how to manage people with long COVID. And then the all-party parliamentary group, they have put many requests to Parliament about things that need to be in place. I don't think all of them have been taken on board yet, but they've done a great job of lobbying for long COVID or post-COVID problems to be recognised as an occupational disease in frontline workers.
Can you understand that with this overpowering threat to the health service from the acute condition, and with the huge public health effort to try and control the coronavirus at large in the population, that it's been quite easy for the people suffering from the long-term impact to almost fall through the cracks of that policy? Has that been a difficulty in getting people to focus on the longer-term impact?
Yes, certainly. I think obviously during the first wave, we weren't aware that there might be a longer term impact, although probably we should have been, because with many viral infections, there can be long-term sequelae that we see. So we probably should have been aware of it, but weren't so much at that point. And then I think that the second wave certainly impacted on people becoming increasingly aware of long COVID. And then while people were becoming aware of it and recognizing that it was going to be a significant health burden within the population, then we reached the NHS being saturated during that second wave and at the beginning of this year. And so a lot of appointments and clinics that were supposed to be in place got put on hold to deal with the acute effects. And I think that that's understandable. You have to deal with the acute emergency. But there is an imperative now that moving forward, even if there are future waves of the pandemic, we need to be able to maintain NHS services and outpatient services and start to understand what's really happening with long COVID and this whole multitude of symptoms that different people experience.
Dr. MacDermott, tell us a little about your own work as a physician. I mean, I know that you were involved in the containment of the Ebola outbreaks in Africa.
Yes, so I work as a paediatric infectious diseases doctor, but I also do disaster response and emergency medical response. So I was involved in the Ebola epidemic in West Africa. I was in Liberia for about 6 months, and then I returned to Sierra Leone at the end of the epidemic to undertake research into Ebola. So I have quite a lot of research experience in epidemic and pandemic diseases now.
So you're in a very unusual position of a physician who's studied in infectious viruses and the impact of them internationally, and you see the impact of the pandemic at home and are yourself suffering from this long-term condition. What message can you give to people in your position that science, which is coming to the rescue through vaccination of the acute spread of the virus, may also be able to hold the key to addressing the problems of long COVID?
I think we need to recognise that long COVID is a heterogeneous group of symptoms and possibly several different conditions within that. And it is likely to be, if you want, the epidemic within the epidemic. And as we come out of the acute phase of this pandemic, and we hopefully don't see further waves, although we may, due to the vaccination now being in place, we need to recognise the significant burden that long COVID is going to place on outpatient services, simply for the access to therapies such as physiotherapy and occupational therapy, but also for the investigations that are involved and the potential for some of these people to have long-term organ damage, especially if not managed sort of promptly, and the symptoms are allowed to sort of dwindle for quite a while. So we need to be treating people, but we also need to be investigating the underlying cause of what's going on and determining the classification of what long COVID is, and possibly trialing some different therapies like we've trialed with acute COVID in hospital. We need to start looking at clinical trials for things that might work for different groups of people within long COVID.
Now, presumably there's a spectrum of the level of suffering. Some people might have long-term but fairly mild symptoms. For some, the symptoms are very serious indeed. Is there a full spectrum of people who are suffering the after effects or long COVID as a continuing debilitating condition?
Yes, I believe so. As we've seen from some of the survey data that's been published from some of the support groups, there are vast numbers of different symptoms reported for different patients. And some people are predominantly experiencing a fatigue-like picture and possibly a post-viral fatigue, which hopefully in time will get better, and certainly with the right therapy support will get better. But there's also a group of people who are experiencing inflammation in the heart, people experiencing problems with their nervous system and neurological disorders. So there's a huge spectrum. And some people will have mild symptoms that might well resolve themselves within a few weeks after their acute COVID, or within the 12-week period. We know from the Office of National Statistics data that we think about 20% of people might be at risk of long COVID following an acute COVID illness, but that by 12 weeks, we're looking at about 10% of people still having ongoing symptoms. So many people will have their symptoms resolve in that 12-week period. But there is also a good proportion of people who won't, and they are possibly the ones that need more intensive therapy input and also investigation into what is going on and how we could better manage their condition.
And Nathalie, for people who are watching the programme, who've recovered apparently from COVID, but something's not quite right, what would your advice be to search out for the information and support groups to give them assistance?
So there's several online support groups on Facebook that can be very easily found by just doing a search, but there's Long COVID SOS, and then there's the Long COVID support group. But I think initially, if people have symptoms that they're concerned about, that the first port of call really should be speaking with their GP and just seeing if they need to be referred for further investigations or if they can be referred to a long COVID clinic or a post-COVID symptom clinic to see if they need any more investigations into possible organ damage, or if they can access then fairly promptly some good advice from physiotherapy or occupational therapy on managing their symptoms and how best to come through this illness.
And finally, Dr. MacDermott, in terms of your own condition, is there hope and progress that you're moving towards recovery?
So I haven't seen any significant improvement in my condition yet, but I'm hoping that with some intensive physiotherapy, I might start to see an improvement soon. But at the moment, I think it's still early days in the recovery process.
Dr. Nathalie MacDermott, you have our very best wishes, and thank you so much for joining us on the Alex Salmond Show.
Thank you very much.
For most of us, hopes of an end to the pandemic trauma are now very real. Many of us have had a vaccination, others are expecting to get one very soon indeed. Across all 4 countries of the United Kingdom, the number of cases of coronavirus are falling, and of course the death rate from COVID is falling as well. The chill wind of a COVID recession is still to blast across the population, but nonetheless hope is in the ascendancy right now. But for those who've been afflicted by long COVID, the nightmare continues and shows no sign of abating. We can only believe that the science which has brought us vaccination will also bring us treatments to relieve that suffering. And so now from Tasmina, myself and all at the show, it's goodbye for now, and we'll see you again next time.